Good morning to all. Good morning, everyone. I'm Ruth, a proud midwife. Today, as I was seated here, I felt like I should discuss with you something that is very common, and it is one of the gynecological conditions that we have, and that is what we call dysmenorrhea. Dysmenorrhea, this is the abdominal pain that is very common, and it occurs before your periods or during your menstruation periods. So in the Lebanese language, someone will come and say musawo olubuto lunuma naye olubuto luno lunuma kubanga ngenda genda mu nsonga zange. So when someone gives you such a complaint, you just get to know that is dysmenorrhea. So it mostly occurs before your periods, and it takes around 1 to 3 days, then it disappears. The severity of this pain, it reduces with the age, sexual activity, and childbirth. That's why I say that okay, this dysmenorrhea, it has different types. We have the primary dysmenorrhea and the secondary dysmenorrhea. And the primary dysmenorrhea, it is very common in the adolescents and the young women. So that's why you find these people who have grown up, the women who have grown up, you will find it is very rare for them to complain about dysmenorrhea. So the more you grow up, the more sexual intercourse you have, and the more you give birth, this pain disappears. So we also have another type of dysmenorrhea, the one we call secondary dysmenorrhea. For this, it has a cause, and the cause is known. That's why sometimes when that abdominal pain persists, we send you for USS, this scan. When they do that scan, they will either tell you have fibroids, like baja kugamba nti olina ebizimba mu nabaana, and others they will say you have endometriosis, when the lining of the uterus, like akabubi akali munda mu nabaanayo nga kalifunye obuzibu, era osobola ofuna olubuto nga lukola ki lukuluma. So those are that is another type of dysmenorrhea. For it has a very known cause. So most of the signs and symptoms, the features of this dysmenorrhea, you will complain of backache, you will complain of headache, you will complain of abdominal pain. So all of those are the features of dysmenorrhea. So when we come out with that final diagnosis of dysmenorrhea, we have different types of management. So we are going to talk about the management.